Released a new report on drug-related opioid deaths and drug-related problems last month. According to the report, more than 63,000 people died from drug overdose in 2016, a 21% increase just from 2015. West Virginia had the highest overdose rate in the entire nation at 52 per 100,000 people. The national average is 20 for 100,000. Ohio had the second highest and Kentucky ranked fifth.
We have to stop this terrible drug epidemic. We have to. If we don't, it will cannibalize us.
West Virginia Governor Jim Justice says landmark work is being done in West Virginia to combat the opioid crisis.
In his State of the State address, the governor said scientists at West Virginia University are developing microchip technology that would provide long-term relief to folks suffering from addiction or chronic pain with an implant smaller than just a grain of rice. News Channel 3's Nathan Takich spoke with leaders behind the project who explained how it might work.
One of our region's biggest problems could soon be solved by something small.
They were the third of the size of maybe a grain of rice.
Researchers at the Rockefeller Neuroscience Institute at WVU are developing micro-implant treatment to help fight addiction.
They can take away the craving.
West Virginia Governor Jim Justice touted the innovation during his State of the State address.
We would like West Virginia to be one of the premier states in the country that is taking the opioid crisis and dealing with it head on.
The Institute's director says they cannot release pictures of their microchips yet, but says there will be two kinds. The first will be specifically for addicts.
The chips are used to basically block the brain and nervous system signals that are contributing to the addictive behavior.
The other would be for chronic pain sufferers who are not addicted, delivering non-opioid medicine directly to the location of the pain, eliminating the need for pills. Testing on humans could begin within 1 year.
We're doing everything possible to fast track this, but number one is safety. If the results of the research studies show benefit, I see this within 3 to 5 years being available.
With the hope that the state that's been the epicenter for addiction can become the epicenter of recovery. Nathan Takich, WSAZ, News Channel 3.
Now, doctors at the Neuroscience Institute say they're also working on external devices that would provide the same kinds of treatment without an implant. Those devices, they say, use magnet technology that's already similarly used to treat depression. Well, this one, though, will curb addiction. In the meantime, state legislators are working on other fronts to cut down on the opioid addiction issues.
Today, the Senate introduced a bill known as the Opioid Reduction Act. West Virginia Senate President Mitch Carmichael broke it down for us today. The bill would only allow physicians to prescribe 7 days worth of opioids, and emergency rooms could only give out 3 days dose. Typically, doctors prescribe for 30, 60, or even 90 days.
We want to put all the roadblocks and checkpoints in place to ensure that these drugs are not being abused. And clearly we have a problem in West Virginia. It's clear.
The bill also follows the Controlled Substance Monitoring Plan, where prescribers and pharmacists would track patients using opioids.